Starting ortho rotation during Halloween definitely means spooky decorations are in store. My first day consisted of orientation before heading over to clinics to see our patients. Every week consists of 4 days of clinic and 1 day of surgery. In clinic, we mainly follow up on patients who have had surgeries in the last few weeks, so they come in to get their sutures removed, get another x-ray to see how their fracture is healing, get their wound checked, cast removed, etc. This is a general breakdown of the physical exam we use to assess our patients, and it includes inspection, palpation, sensation, motion, and motor/strength. After we finish talking to the patient, if they need a cast or brace, we take them to the cast room so they can be appropriately fitted. Then we head back over to the workroom and type out the progress notes before seeing the next patients. Here's the cart that contains the majority of supplies we use in clinic. In the top drawer, we have alcohol wipes, ointment, lidocaine, etc. for injection purposes. Moving down, we have tape, ace bandages, suture removal kits, gauze, etc. And here we have our various syringes. And lastly, here are some extra supplies as well as surgical gloves.
So yesterday was orientation in the morning, which means today is like my first full day. And generally we kind of like just round on patients and check up on how they're doing at 5:45 a.m. And I'm actually feeling pretty good today. Like I woke up of my own accord at like 3:30 and then I just couldn't fall back asleep. So I just got up shortly before 5. And I feel like I have more time. I feel like I got a little bit of stuff done in the morning before my day started. So I definitely understand the people that are like really morning people. Not like 3:30, but just like, 5 a.m. on a daily basis if they have to go to work at 7. Because it feels like you're productive. It feels like you're getting stuff out of the way before you actually start work. And, I can see the appeal. But yeah, looking forward to the day. So I just finished my second day in ortho clinic and I felt really dumb today. So generally, the majority of the patients that I've seen have come in for follow-up visits of fractures for which they got open reduction and internal fixation surgery. So majority of the time, the physician will order an x-ray so we can see how well the fracture is healing. And I brought up the x-ray and I chiefed the patient and went through the history and physical. And then the physician asked me what is arthritis, and I kind of went into osteoarthritis versus rheumatoid arthritis, and he was asking me what is keeping the bone from touching each other on the x-ray. Because in arthritis you often see narrow joint space, and that's one of the signs. And I was like, synovial fluid, joint capsule. That was not the answer. The answer was cartilage. Cartilage. I just felt, yeah, and he made it clear that I really should have known that, and I really should have known that, but I didn't. And I think one of the disadvantages of med school, at least the way that I've been learning, is that a lot of the times all the tests are multiple choice exams. So I recognize when I see the answer and I can tell you this is the answer and these are the other ones are generally wrong, but you ask me to explain it using my own words, I'm not as good at doing that, and that's something I do need to work on because I feel like my knowledge is kind of limited to recognizing as opposed to being able to articulate that myself. So definitely something to work on. But overall I feel pretty good about clinic. I've definitely noticed that I've gotten more comfortable in a shorter amount of time. For example, when I had my first rotation in pediatrics earlier this year, it took me 1 to 2 weeks to feel comfortable seeing patients on my own. I was doing it within the second day, but I wasn't really comfortable, versus it's the second day of my ortho rotation and I'm already feeling pretty comfortable, grading muscle strength, checking for sensation, knowing kind of which specialty test to perform on the patient, knowing which questions to ask, etc. So it's kind of nice to see that progress, even though it's obviously been gradual and happening over months. And then tomorrow I'm gonna go in for a couple surgeries. I'm not sure exactly which ones. I'm gonna split up with another med student, but I think the majority of them are lower extremity fractures. So I'll just be reviewing the anatomy for that tonight so that I'm ready for tomorrow. And I have a feeling that whatever they ask me is gonna be something I did not review or did not review in as much detail. So I probably will still not know the answer for whatever they ask me, but at least, I'll have a better understanding. But yeah, I'm actually really enjoying ortho clinic. And then I am going to go jogging because it's been a hot second, especially with neurosurgery. I was not able to exercise like at all during my shift. So there's a little bit more time with this rotation. So I'm gonna do some exercise and then do some studying and call it a night.
The next day, I scrubbed into my first orthopedic surgery, one of which was a fusion of the pelvis and spine, and another one was a right ankle external fixation, which sounds exactly like what the name implies, where they screw rods into the bone and attach them to an external stabilizing device outside the body to maintain the fractured bones in alignment. As always, it's important to have the proper attire during surgery and to properly scrub before entering to reduce the risk of infection and contamination. One thing I didn't know about ortho surgery was the amount of x-rays that are used intraoperatively, so during the surgery it's not uncommon for dozens of x-rays to be taken to ensure proper placement of rods, plates, etc. For that reason, we always wear leads to protect ourselves from radiation exposure. The rest of the week consisted of more clinic. I got to see casts being put on and taken off. I learned how to apply wet to dry dressings, remove sutures, and apply steri strips, which are essentially sterile pieces of medical tape for wound closure purposes. I was on call for Saturday, which means we just chill out in the workroom and wait to be consulted for any traumas that may require orthopedic surgery. It started off fairly quiet, so we had some time to study at the beginning of the shift. Then we got a handful of patients all coming in at once, some of which were due to a motor vehicle accident that included several cars. I helped apply a splints and unfortunately got a small amount of plaster on my scrubs. I can definitely see why it's said that you should be in fairly good shape or at least have some sort of strength to go into ortho, because reducing fractures and dislocations at the bedside can be pretty tiring with the amount of force that's needed to be applied at times.
Good morning, second week of ortho surgery. This week, Monday at least, we have a lot more patients. So last week, I think we generally schedule similar amount of patients, but a good amount of them no-showed. Each day is different. Like one might be upper extremity, another might be lower extremity, one might be spine. So today is pediatrics, and apparently we have a lot of patients scheduled, like more so than usual. So I think it'll be pretty busy.
Getting to the clinic at either very early or very late hours brings about a sense of calm that I wouldn't really know exists in the hubbub of day-to-day hospital proceedings, and I actually feel a sense of home, peace, and belonging during those hours. The next day, I was scheduled to scrub into an open reduction and internal fixation of a right radial fracture, which means they cut down to the bone and then place screws, plates, sutures, and or rods to stabilize the fracture. I also scrubbed into an elbow ligament repair surgery and met the happiest surgeon ever, which really made my day and made the surgery itself quite enjoyable.
So I just finished my second to last day of this rotation, and I felt pretty dumb today. To give some background, last week I was assessing a patient who came in for a fracture. I was checking for range of motion, checking for strength, and when I talked to the attending, he asked me if the patient was in a sling, and I said no, and he said that the patient should have been in a sling and such assessment should not have been performed because the fracture wasn't very stable, so having the patient move their arm and such wasn't necessarily recommended. He said I was all right because I wasn't aware, and then the sling should have been put on afterwards. Then I was just like, okay, so from now on I gotta be a bit more careful about which test to perform. Later that week, I asked another attending how to determine whether I should be performing or like assessing range of motion and strength in patients with fractures, and he said that as a med student, he doesn't really expect me to know that. So just kind of ask when in doubt. So obviously, if they're healing, if they've been casted, then I should do that. But if it's like kind of a new fracture, then I should kind of ask. So today I had a different attending because generally we have a good amount of attending, so they kind of rotate throughout the week. So I asked the attending today if I should be performing a physical exam on this patient, and he looked at me and said, are you seriously asking that? And I should have clarified, should I be assessing full range of motion and strength instead of physical exam, because the physical exam also includes like inspection, looking at a palpation, and just there are other things you can do other than motion. And then also looking at the x-ray, I wasn't exactly sure what I was looking at. I could see the fracture, but I'm not the best at telling whether it's healed or whether it's like a fairly new fracture. And then he kind of showed me the callus formation and kind of said that this fracture was sustained around 6 weeks ago because you can see the callus forming. So definitely okay to kind of assess range of motion and strength and such. But I think the way he was like, are you seriously asking that question, just made me feel really dumb. But at least now I'm a little more aware of new fracture versus old fracture on an x-ray. And yeah, so I feel pretty dumb, also kind of tired. So I think that kind of factors into feeling a little low right now. But on the bright side, I did learn how to do a knee injection for osteoarthritis, learn how to palpate for the patella and the patella tendon, and then inject at a 45-degree angle in the inferior lateral aspect. So I am learning. It's just making mistakes or feeling dumb is part of the learning process, and I have to remind myself of that, but it still sucks emotionally, but we'll hopefully feel better after a nap. And I also ate Chipotle after I got back, so food definitely helped as well.